My name's Susan Olson. I am a lung cancer advocate, and I became involved back in 2015, and the reason I became involved is because my sister had lung cancer. I tell people that this is not necessarily something that you seek out to get involved in. Most of the people I've met involved know someone or love someone who has had lung cancer. My sister's was a stage 3B, which is a little bit later. It means it's already in your lymph nodes. So like many cancers, the early screening and early diagnosis will be better for treatment and outcome. I felt like when I looked at my sister's story and how she started out with symptoms of things, her symptom actually was left shoulder blade pain. So as she saw her primary care, they sent her to actually a gastroenterologist first, and then she ended up with a pain specialist, and they did a chest x-ray, which actually showed nothing, and that was only a year ahead. So it wasn't until the pain specialist decided to do a CAT scan that they saw the initial first spot there. With somebody like her who had some risk factors, but her symptoms and risk factors wouldn't necessarily tell us or a doctor that she was at risk, means that to have more conversation or for people to be aware that many of us may be at risk, and so having a discussion with loved ones or your doctor about whether you should get that screening and the benefit of knowing as early as you can because of how the stages, the early staging, is certainly going to be a better outcome if we can find it earlier.